The AUDA-NEPAD implements its mandate through 6 broad thematic areas. These are knowledge management, human capital and institutions development, technology, innovation and digitization, industrialization, environmental sustainability, finally, economic integration.
These thematic areas translate into a number of flagship and priority projects that contribute to the AU agenda for sustainable growth and socio-economic development.
The 100,000 MSMEs initiative is a fit-for-purpose flagship program with services designed to build the capacity of MSMEs and to improve their access to finance and new markets. Over 18,000 MSMEs in 33 member states have been trained so far, and a funding window for 1,600 MSMEs in 8 countries has already been made available.
The COVID-19 crisis has laid bare many of the structural, social, economic vulnerabilities and weaknesses in Africa, such as poverty and inequality. The African Union Development Agency, NEPAD, undertook rapid interventions geared at improving access to sustainable and resilient health services, ensuring food and nutrition security, and developing internal markets while strengthening the protection of Africa's economic foundations. To this end, the African Union Development Agency, NEPAD, worked directly with the Africa Centers for Disease Control and Prevention to provide field support using its network and to coordinate meetings and trainings of mainly medical personnel.
The objective of the African Medicines Regulatory Harmonization Initiative, AMRH, is to ensure that African people have access to good quality, safe, efficacious, and effective essential medical products and technologies. The AMRH initiative started in 2009 to address the fragmented regulatory systems on the African continent and to provide an optimal environment for local production of medical products and health technologies on the continent. For over a decade now, the continent has witnessed significant progress in harmonization of technical requirements for registration of medical products and good manufacturing practice, with subsequent reduction of timelines for marketing authorization. 17 African Union member states have domesticated the AU model law on medical products regulation so far. 11 regional centers of regulatory excellence have been designated to provide sustainable mechanisms for production of regulatory workforce in Africa. The AUDA-NEPAD is now working with African Union Commission and WHO to establish the African Medicines Agency.
It is increasingly obvious that global climate is warming faster than earlier estimated, with widespread effect for agriculture, energy, health, marine ecosystems, water resources, and some industries across the world, and especially in Africa. The African Forest Landscape Restoration Initiative, AFR 100, is a country-led effort to bring 100 million hectares of degraded land and forests into restoration in Africa by 2030. In this way, AUDA-NEPAD is providing a direct response to strengthening climate change resilience, enhancing food security, and combating rural poverty.
There was this need now to amalgamate all these plans and all these new thinking and initiatives around infrastructure and come up with the Program for Infrastructure Development in Africa, PIDA. So that was the basis. So it was supposed to be this program, or it is the program that it's meant to be, to transform this continent and integrate us. I think Kazungula is a living example. Namibia, Botswana, Zambia, Zimbabwe. As you know, there was a ferry service that used to go up and down. And now you have 2 border posts. You clear at one border post, you can smoothly drive through another country. Not to mention the delays in cargo, and just a huge improvement in the value chain.
These are a few of the flagship projects AUDA-NEPAD is implementing in more than 50 countries where we have a footprint.